You may not have heard some of these answers, but I'm going to be posting a few true or false questions, and I'm inviting you, the viewers, you green warriors, you can type in or just think in your head the answer if you don't want to type it in. So just type in true or false, because we're going to talk about some of the myths about this. So the first question that we're going to ask is, in order to have blood tests ordered, you need to visit your physician's office. True or false? So you can type in your answer or just think it in your mind, and Dr. Marbas is going to answer that question.
That's depends. So that's typically false. It depends on what state that you live in. Certain states require a physician's order. So for us, we would prefer that you meet with us first so we don't waste your time or money and order the labs that are appropriate for you. That is really, really important, because there may be some labs that, of course, are obvious that we'd want to check, is like a lipid panel or cholesterol panel or your blood sugar. But there may be other specialized tests that we feel are important for you at your current state of health or need. And so, again, it really depends on your state. Some places you can actually go and just request it and pay for it yourself. And other states have actually put some barriers between a patient being able to do that themselves.
Okay, let's go for our next question. Get ready, guys. A physical exam is needed to diagnose me. True or false?
It
Marbas?
really, it depends, right? So it depends on what you're talking about. If you're coming in complaining of abdominal pain, or if you're complaining of something that obviously needs a hand-on test, absolutely. Now, there's other things that we can do very well with just the physical visuals component. You know, if someone has a rash, they can describe joint discomfort and show it to me. I can have them do specific tests. Of course, I can't listen to your heart. I can't listen to your lungs. I can't do certain tests, but I can order tests. So again, it really depends on what we're talking about. So of course, all mental health is done just via talking. But we can also order blood tests. So for example, if I have someone who's coming in to me to talk to me about their diabetes, I don't need to do a physical exam to diagnose you with diabetes. That's a blood test. However, you do need to make sure that you have your foot exam done every year by a podiatrist or your regular doctor to make sure that there's not any nerve damage or loss of feeling. So again, it all varies. So there's layers of complexity. As you get more complex and more, urgent, I would say that you would definitely need to have someone in person. We like to work with someone's physician. We don't want to be the physician. We don't want to be someone's PCP. We are just meant to be kind of lifestyle medicine specialists.
Okay. All right, guys, true or false? Here's the next question. Telemedicine uses Skype or FaceTime, so I should be concerned about the security of my highly confidential information. True or false?
Again, it depends. So I can just speak from our system and what we're using. We actually use a HIPAA compliant, meaning a federally recognized system that is safe from hackers. So you have your patient portal, that it's a safe place to send messages. Your information is there, your labs, your meds, all that is there. And we use Zooms. So again, that is our safe place. And for others, they may be doing something separate from that, but at least from plant-based telehealth, trust me, we are very, very aware of all the medical regulations. We don't want to get in legal trouble with anybody. So very, very compliant from day one. We've been that way.
Okay. And I just want to let people who are watching know that Dr. Laurie Marbas is an MD. And if you have any questions about plant-based lifestyle and as far as adopting it, or medical questions, general medical questions that she could point you in the right direction for, you're free to ask those questions as well. Okay, let's go for the next question. My online doctor can't write me a prescription. True or false?
Again, that depends. So yes, we write prescriptions. We cannot write controlled substances via telemedicine. That is actually against federal law. So as long as it's for your diabetic meds, your hypertension meds, your thyroid medications, absolutely 100%. And honestly, we're not in the business of writing controlled substances such as opiates and things like that anyway. So that's kind of out of our specialty. And so that's the depends part of that.
Okay, and let's do another question. I can only use telemedicine for urgent care or as a last resort. True or false?
False. Don't use telemedicine for urgent care or last resort. If you're having what you would consider an emergency, you need to call 911 or present yourself to an ER, or someone can physically lay hands on you. And that would be especially if you have low blood sugar or low blood pressure, or where you're feeling you pass out, or you're having chest pain or any discomfort. That is not something that you would want to dial up someone on a Zoom, because I can't help you. You need to be seen in person.
Okay. Well, I hope that helped people dispel some myths. Now, you were talking about talking to people, for example, you brought up diabetes. And can you expand a little bit about how you monitor their blood sugars and also maybe even help them titrate their medications?
Mhm. Yeah, absolutely. So I think the one thing to understand is that we specialize in deprescribing, which is reduction or elimination of medications as someone improves their health, eating a whole food plant-based diet and incorporating other lifestyle measures. So specifically with diabetes, I love to use what we call continuous glucose monitors. And these are small devices that attach to either the back of the arm or the abdomen, where it's continually monitoring your blood sugars. And one, it's a wonderful feedback mechanism for the patient as they're eating, if they're being active, seeing what food choices and the long-term effects, either the day, the few hours after the meal, or as it is a stay on for many hours. If you eat a high-fat meal, go out and eat the processed vegan food, you'll see it affect blood sugars for maybe 2 or 3 days, depending on how insulin resistant you are. So those are some very handy tools. And then we share that screen with the patient. I can see all their blood sugars. That is one of my favorite ways. And then, of course, if we had patients as they hit certain markers, especially with blood sugars or hypertension, we cut down insulin, we cut back on oral medications. And there are points that you basically reverse your diabetes. Now, that is type 2. I also have many type 1 patients. And what we do is we reduce the amount of insulin that they require, because we're making them more insulin sensitive. And we're also teaching them how to do injections and how much they need. And so they don't get these really wild swings. So they're not always chasing their blood sugars. So there's certainly an art to it, but it's really important to educate the patient, and so that they have that feedback themselves, so they can start making those decisions and not rely on a third-party physician.
Wow, that's amazing, because most times when people have type 2 diabetes, they're told that they're just going to be on these medications for the rest of their lives just to manage something that, and meanwhile, they probably start out not on insulin and then eventually end up on insulin because
Right.
the medications are not
Oh, yeah.
doing it. And so now if somebody had a doctor that they saw, but then they wanted to do the telemedicine with someone like you, and they had the type 2 diabetes, and you were interested in titrating the medications down, how does that work? Because so often it can be a little frustrating to communicate to one's doctor that that's
Mhm.
what they're interested in doing and that it's actually possible.
It really depends on the patient and their physician's relationship. So many times, what we see is that physicians are so busy that they're busy writing prescriptions and getting people out the door. So any help that comes along the way to help control that patient, get them in better shape, that physician, if it's their primary care doctor, will actually benefit in the long term, because there are certain markers of achievement taking care of patients that you're looked at each year as far as reimbursement from like Medicare and other insurance companies. So how many of your patients actually meet the hypertensive goals? How many patients meet, their diabetes being controlled goals? So again, if you're coming in and helping manage that patient, many physicians like, hey, whatever you're doing, keep doing it. It's one less problem on my plate. That's how the majority are. There are some who feel very protective over their patients and almost very defensive, in the sense that, like, wait, what do you mean they're stopping your medications? And that's not very many, but there is a handful, and it really puts the patient in a really compromising, difficult position. So I tell them, well, you can either delay your follow-up with them and just go back to them in 6 months instead of 3, because I'll be seeing you and taking care of you, and you can go back with less medications and a better state of health. Or you can say, well, this is what I'm doing, and be honest with the doctor and just deal with the ramifications. Or sometimes patients don't even tell their doctors because they don't even want to deal with it. So again, it really just depends on the patient. I'm happy to speak to any physician if they reach out to me, but nobody ever has. In all the years I've done this, not one physician has reached out to speak to me about what I'm doing with their patient, because usually they're getting better, and the patient is very happy. They're getting way more attention than they ever did before, and the education has been invaluable for them. So now they're coming back to them a much better, well-versed patient in a healthier state honestly, if I was family physician, I was a PCP for many, many years, I would be tickled to death. If anything, I would say, like, what are you doing so I can, replicate that with other patients? And so that's what I've seen so far.
Wow, that's great. It almost seems like the traditional doctors are not trained on how to titrate down medication.
No, they're not. And honestly, when you actually start looking at the power of a plant-based diet, I didn't know this, 10 years ago when I started using it in my regular practice. I mean, I just didn't understand how quickly blood sugars would improve, and in some cases, hypertension. And so you have to cut down very quickly. I had one patient that I stopped 60 units of insulin in 72 hours. So now, if I have a type 2 diabetic and they're going to go 100% whole food, plant based, no oil, low fat, I will cut their insulin typically in half. And that's just not uncommon, because the goal is to avoid the low blood sugars. The low blood sugars will get you in trouble. The higher blood sugars we can handle, but those low blood sugars, we don't want people that could be lethal.
Right, because they're essentially becoming dangerously over medicated.
Absolutely. Yeah.
Right. But this is not the kind of thing that somebody who is not trained, especially someone who is just adopting this lifestyle, and they're thinking that they can titrate their medications. This is not something that they should be fooling around with. They need to consult with somebody that is a
Mm-hmm.
professional that knows how sensitive these medications can be. And
Right. Absolutely. Because there's a certain order to medications. There's certain medications, not necessarily the diabetic meds, but certainly a variety of hypertension meds that you would want to titrate down a little bit more slowly. Some that you'd want to stop first. Yes, you probably should speak to someone who actually has some knowledge about the medications and not just try to do it yourself. I think might be playing with fire.
right, and it seems like with the continuous glucose monitor,
Mhm.
you would have, like, I guess, 24/7 access to these numbers,
Yep.
and if you saw something spike or drop, you could
Well,
contact the patient and say,
I
"What's
have
up?"
hundreds of patients on these, so they would need to contact me. So they would send me a message through the portal, which I'm checking daily, and they're like, "Hey, I'm seeing this trend. What should I do?" And that's honestly, it happens daily. I'm happy to send them. I'll jump on and take a peek at their blood sugars and go from there. But I'm not monitoring all of these blood sugars now. If I have someone that I'm worried about, I may find myself just checking in on them. And that's happened for sure, especially my little kiddo type ones, like a 4 or 5 year old that they're just starting insulin, moving to a plant-based diet. I'm trying to help out the parents. They'll usually end up with my cell phone number because I really want them to have full access. So,
Right, because even people with type 1 who are obviously on insulin, it
mhm.
is possible for them to reduce some of the
Yeah.
insulin that they're taking.
Yep, absolutely. And it's really fun to see them when I tell them you're on a physiologic amount of insulin, meaning this is how much your insulin your body would be making anyway, just if you were a non-diabetic. And that's always really fun for them. And when we see nice, tight control of blood sugars, where they're not getting too high, they're not getting too low. Of course, on occasion, little wonky things will happen. But overall, they do very well. They feel good, right? So the blood sugars aren't too high and they're not chasing those highs and lows. And that whole, this up and down, what we call variability, can be really exhausting for patients.
Yeah, that's really great. Back in 2012, as I talked about in my intro, my husband and I adopted the plant-based lifestyle, and I was very close to being on all kinds of medications as my
Mm,
numbers were creeping up, and I knew that it was in my genes because, I had my mom and dad and grandparents and so forth. So luckily, I was able to go back down with my numbers without ever having to be on prescription medication, although I had different issues that a lot of people see resolved. But my husband was on cholesterol medications. He was on hypertension medications. So when he was trying to do this, of course, now in 2012, we didn't have plant-based telehealth, and we
mhm.
didn't have access to a lot of plant-based doctors that you could just, contact them and help, ask them for your help. So fortunately, his physician was on board with, okay, I'll work with you, but I need you to buy a blood pressure monitor. I need you to, take a journal. And so we were doing it several times a day with the blood pressure monitor, and slowly he was coming off his medications. And at the end, when he had lost over 100 pounds,
Wow.
when his blood pressure was, like 90 over, I don't even, I mean, everything was just great. And his
Wow.
cholesterol, was under 150. All these numbers just came down. And
Hmm.
so then he finally said to his physician, I would like to now come off completely because I'm on a low dose for the hypertension. I'm on a low dose for the statins. Now I think I should just come off them completely.
Hmm.
And he really didn't want to budge with
Mm.
eliminating them completely. So he said, I'll tell you what, you go to a cardiologist and have a calcium score
Hmm.
scan done, and then let's see what he says.
Mm.
And so, his score was good, but it was so funny at the end. I can't remember because it's back in 2012, but one of the doctors said, "You can come off of all your medications, but I just want you to be on this low dose for hypertension." And then the other one said, "You can come off all your medications, but I just want you to be on this low dose for cholesterol."
Mm.
So
Yeah.
it just would be nice to have a physician that you could just be on the same page and they could help you make that decision and
Hmm.
know whether, because they're familiar with the lifestyle and they're familiar with the need or not for these
Right, absolutely. And there
medications.
are times when you require medication still, and that's okay too. I always remind people there was a life before plant-based diet for most people, and that life has consequences. So there will be times where certain patients require certain medications, but you certainly, if your blood pressure is low, to keep you on a low amount of hypertension meds is dangerous. I don't agree with that. I'm talking blood sugars and hypertension. I get you off those meds as quickly as much as possible. Now the cholesterol, that's a conversation. Coronary calcium score, I ordered plenty of those. We ordered DEXA scans. We talked about osteoporosis. There's so many things that we have to look at and determine, well, maybe a statin maybe is indicated for you because you've already had 3 stents and you're at high risk for heart attack. You can't quite get your cholesterol where we want it to be. There's absolutely indications for certain medications, and those medications can be beneficial. And that's the other thing that we run into, is I call it guru syndrome. So certain people will say certain things, or they hear this person say or that person say, and they're like, I don't know who to believe. I'm like, I'll tell you what, why don't we look at the science, and then let's talk about you as an individual, look at your data, your needs, your desires, and we'll make that decision together. But we have to make all that decision with as much information as we can. That includes in-depth lipid profile outside of your normal lipid profile. What is your inflammation rates? What is your coronary calcium score? How is your blood pressure controlled? Have you met your ideal weight yet? There's so many factors to play. What are your genetics? Like, my real dad had his first heart attack at 38. My mom's dad died at 46. Genetically, I'm not in a good place. So I really need to make sure that I stay in good health, which I have been for all these years. But I certainly could have, if I'd have adopted an unhealthy lifestyle early on in my life, which I didn't, thank goodness. But those could have definitely had some severe consequences to me, because genetically, there's things ready to just take off. So, the gun to go off, so to speak.
Exactly. And I'm so glad that you were talking about medications, because sometimes there is a call for medications and procedures.
Hmm.
And now, because you're a lifestyle medicine doctor,
Hmm.
then you're going to be considering all of these things, right?
Right, absolutely, 100%. So we're still physicians, we're MDs or DOs, and we're definitely still steeped in the science and, look at the guidelines, but understand that these guidelines are based on people who are eating a standard American diet. We understand that as well. But we also understand that people come to us, but just because you went on a plant-based diet last week does not mean that your heart attack risk suddenly disappear. So there is work that needs to be done, and it may take several months or years or, longer.
Okay. Well, it looks like we have some questions.
Okay.
So let's see. Carla R. I have fibromyalgia, lots of pain. Can a whole food plant-based diet help me?
Oh, absolutely. So let's think about, so fibromyalgia is a really difficult entity because there's no test that I can do. Like, I can't run a blood test and determine, hey, this is what you have, or I can't do any imaging and say, this is what's going on. So it's a very um, unique and odd, it's kind of one that you get out of exclusion. You've excluded all other diagnoses, arthritis, different things like that. So, but what's interesting though is lifestyle measures definitely improve, I would say, the majority, if not all, fibromyalgia cases. So now you're eating a whole food plant-based diet, which is very anti-inflammatory. You're removing foods that promote inflammation. And you're also, once you start feeling better from that standpoint, you start exercising, and exercise and nutrition definitely go hand in hand. And having someone either completely eradicate the fibromyalgia symptoms or definitely significantly decrease.
Well, that's encouraging because I know that that's something that's still kind of a mystery and can be kind
Mm-hmm.
of frustrating for people to have to deal
Absolutely.
with.
Absolutely.
Okay, let's see. Jared C. Whole food plant based dropped down to normal weight in 1 year. Wow. Primary doc said because my white blood count is 3.6, too low. He wants me to see a hematologist for a bone marrow biopsy. What are your thoughts?
Oh my. So I feel like we should have a separate blood panels for plant-based eaters because you will see things very odd. And the white blood cell count dropping is very, very, very common. And I would say, isn't it even as if you hit to 2.5, especially if you've always kind of been on the lower side anyway, and then you're eating this really low inflammatory diet, you will see the white cell drop because white blood cells, remind you, are not just for infection, right? They don't just fight infection, but they're also a marker of inflammation. So when you have this low inflammation, it doesn't mean that suddenly something's not working. What this means is that that's probably where you are. Genetically, that's probably where you should be. It just tells me that you're eating a very wholesome, healthy diet. And as long as there's no other symptoms or other concerns, I would speak to your doctor and say, I'm healthier than I've ever been. I feel better than I've ever been, you know. And I'm like, I don't necessarily, why don't we watch it and see what happens? Or you could go and, I call this, when you look at these tests and people just running tests and they see something and they send them to the specialist, they send them to specialists. And we wonder why we have such a high, when you look at the amount of medicine that costs this country every single year, it's just because we're really playing defensive medicine. We're not looking at the facts and saying, here's the best decision for this patient. They don't need to see a specialist. They don't need additional testing. But again, as long as that's kind of been your trend, you're not having other symptoms that would be worrisome for, low white count, or other markers aren't too, like your platelets or something else, or you're not anemic, I would say you're probably fine. If this was me and you were seeing me and that was the only marker and it went from being low normal to now below normal and not, I'm not worried about other things, I would say you're fine. So,
Yeah, and it's, I guess, and you use the word normal
right.
because normal is what? What?
Right. Well, you got to remember, so when they make any blood test, so there's this reference range that these are basically, think of it as a bell curve, right? So you have the bell curve, and this is 95% of the population will fit inside of this bell curve. And you have 2.5% below the bell curve that's normal and 2.5% beyond the bell curve that is normal. So you have these things to think about as long as you're, within reason, not too far askewed. If I had someone dropping below 2.5 and other things going on, that would be a little worrisome. I might absolutely send them to see a blood specialist. But at 3.6, I would struggle to send someone in.
Well, that's a relief.
Yeah.
Okay, let's see our next question. Gina S. I am whole food plant based. My gastroenterologist wants me to drink chicken broth to prep for a colonoscopy. How can I stay plant based and prep for I have heard this question so many times from people.
That's
It's really
interesting.
frustrating.
Just get some veggie broth. You'll be fine. Just replace it with veggie broth. You'll be all
And
set.
that's it. And there's no, and I've also heard some other people talk about there are certain special foods that the doctor wanted them to have before they were, drinking the prep, and
Yeah.
they weren't plant based, and people were really
Just tell them
concerned
you
about
can't do
it.
this. You're gonna have to provide me alternatives that fit within. I mean, if someone is allergic to those foods, their doctor wouldn't prescribe them. So again, it goes to, this is what I eat. Doc, what you want me to do? So give me an alternative. And if they're still unwilling to do that, please feel free to contact us at Plant Based Health. We'll be happy to walk you through that. So that's slightly frustrating. Absolutely. But
Yes.
a veggie broth would work just as fine.
Okay. So Jamie T, my primary doc said my LDL of 70 is
That
too
is too
low.
much. That's too much
I
for me.
am whole food
Okay.
plant-based. All medications, including statins, are now eliminated. He said all other levels are fine. Thoughts?
Oh my gosh, your LDL is too low? Absolutely not. So when you look at where does heart attacks happen, right? So when you look at population studies, observational studies, and you're like, okay, what is that LDL? Because that LDL is really important. When you see someone 70 or below, even below 60, heart attacks don't happen. I've never heard of anyone saying LDL is too low. That is insane. That is absolutely insane. You might want to see another physician, because to say your LDL is too low, absolutely not. And that goes against the American College of Cardiology,
Ooh.
all of those guidelines. So I'm a little confused. So I
Mhm.
absolutely, LDL at 70 is beautiful. Congratulations.
I was thinking that maybe this person might have meant HDL, and I'm curious about HDL because I've heard people talk about that the HDL, which is supposed to be the good
Yep, it's
cholesterol,
a good
right?
cholesterol.
So that for some people, as their cholesterol comes down to
Mhm.
what we like to see,
Yeah,
under 150, that their HDL, which is good cholesterol, comes down. So
right.
is there ever
Right.
a concern with that?
It depends. So I obviously don't want your HDL to drop too low, because that tells me you're probably not exercising very much. But it is
Um,
very common. It makes sense physiologically. So what does the HDL do, right? It's a dump truck, right? So the dump truck goes and grabs the bad cholesterol, which is your LDL, and hauls it off. So if you have less bad cholesterol, you need less dump trucks. But remember, HDL is kind of a U shape, right? So there's a sweet spot here that we want you to be in, that 40 to, I think it's 80 in certain. And as you get higher, there was when they noticed that HDL was the healthy cholesterol, of course, the pharmaceutical industry is like, hey, what drugs can we do to bump up the HDL? When they did that, people actually started having more heart attacks as well. So there's a U shape. You don't want to be too low and you don't want to be too high. So the sweet spot is really important to think about, and exercise is really key. There are some genetics that play into this a little bit, but again, I think, just thinking about what you can do to just really prevent yourself and decrease your risk for heart attack overall is exercise, eating healthy, rest. Sleep is so not addressed in the majority of our regular medical practices. Sleep is so very important. I tell you, if I can get your sleep and your diet right, so many things fall into place. You have more energy, you start moving more, the exercise takes care of itself, you're in a better state of mind to deal with stress, and on and on and on. And so again, sleep, nutrition, and the rest will take care of itself typically.
Yeah, it's so important for the bears, but we don't think about it as much for us. And it is very important. So
Right.
as far as blood tests, normal blood tests that people would go for a regular panel, and now we have people that are eating plant-based, and maybe there are certain things that they should be looking for. So, and again, you can order blood tests for someone.
Mhm.
I've had struggles trying to convince my physicians to order certain blood tests that I felt were important to me, that they didn't think were called for unless there was a medical reason.
Mm.
So I'm talking about, maybe like the DHA EPA thing, and well, of course, the B12, maybe the 25 hydroxy, or, just things like that. Do
Mhm.
you typically order, which blood test do you like to order for someone who's on a whole food plant-based diet?
Yeah, so I certainly came up with a template. So there's certain nutrients that we'd want to make sure that patients are eating enough of, because it's really interesting when you get people who switch to a plant-based diet. You would like everyone to be eating a very diverse plant-based diet, but there are people who don't like certain vegetables, they don't like beans, they cut out beans altogether, or they don't want to do this, or they don't want to do that. So it can be a tad bit frustrating, and you want to make sure they're supplementing correctly. So typically what I would put in my plant-based panel includes a CBC, which is a complete blood count. That's going to make sure you're not anemic. That white count would be part of that. A complete metabolic panel. Let's check your kidneys, liver, things such as your sodium, your chloride, your calcium, your protein status. Those two are very simple. Most people have had those done at some point. The other things, we check your thyroid, just a general, because a lot of people are now salt free and they don't think about iodine. And what I've seen is some patients who've been on a very strict SOS free plant based diet come in and they're like, hey, I was just diagnosed with hypothyroidism. What's going on? And I've been dealing with hypothyroidism for 25 years since the birth of my second child. And so I kind of just really enjoy the thyroid. But the thyroid really requires iodine to make its hormone. So that's a 24-hour urine iodine test. The blood test is not as accurate. So you want to collect those. And I've seen plenty of cases where patients coming in, we need to put them either on iodized salt or use some type of very small 150 micrograms a day of iodine replacement. But you don't want to take that unless you have to, because you can take too much iodine as well. So it really depends. That's a 24-hour urine test, guys. So if your doctor's going to order it for you, make sure it's a 24-hour urine. And it's a pain to collect, I understand, but it's really important. So that's there. Then we have your A1C. We're screening for diabetes. When a third of Americans are walking around as pre-diabetic or diabetic, that's really important to look into. And then we do other things like magnesium. If you're anemic, we would want to make sure and check your iron. We also check selenium. We check zinc. We would also check your omega levels, to make sure your omega-3s are good, because remember, the plant omegas that we get are these short chain omegas. And so that's ALA. Very little of that is actually converted to the long chain in the body. So then we would check those, because on occasion you probably might need to supplement. And we've seen patients improve in mood. We've seen memory improve. Sometimes inflammation will improve when you up their omegas a bit. And not everybody needs that, but certainly there is a handful. And when we're also looking at your vitamin D status, unless you're out in the sun a lot, I think it's a little bit more than the 10 to 15 minutes that people mention. The majority of my patients are on B12 and also vitamin D. With that comes better immune system, again, mood, lots of different things, your bone health that you want to be concerned about. That again, there's many things that controversy as far as your vitamin D status, but I certainly see things improve when you get to a threshold such as 30 nanograms per milliliter on your vitamin D status. Now, with that in mind, we also want to check B12, make sure that you're supplementing correctly. But we also order homocysteine and methylmalonic acid. So these things are coupled to B12, and that will tell me if your B12 is adequate enough inside of your cells. So there's those as well. So let me think here. Went through all of those. Just going through my head as I would be. That's the majority of those, I would say. And then, of course, if there's something else going on, there may be other additional tests that we would order. I would think majority of my physicians are happy to order whatever tests that you would like, just out of curiosity. Sometimes women want to see their female hormones addressed. And, we talk a lot about menopause. As you can imagine, majority of my patients are women. Many of them are in this, either 30s, 40s, entering into menopause, 50s, because I'm in my 50s, 60s, 70s, whatever. Those, you'll see all sorts of patients have different symptoms. And, again, those are fine. I'm happy to order those tests as long as, we're going to act upon them. So that's kind of how you have to think about labs is this going to be a lab that I'm going to change my management, or is it just because the patient truly wants to know? And I feel like if the patient truly wants to know, let the patient, that's fine. There's nothing, their insurance may not cover it, but as long as the patient's aware of that, that is fine. As when we order labs, we order medications, you can bill your insurance. That's not a problem. So typically, unless you're like certain like things like Kaiser may not let an outside doctor order medications or labs. I've seen certain Kaisers, and again, they're sectioned off in different parts of the country. Some of them will allow our physicians to order medications as such, but some will not. So it depends. If you're in an HMO type of insurance setting, that might be an issue.
Right, and you're all familiar with some of the insurances. I mean, there's too many for you to know everything about
Oh
all of
my
them, but you
heavens.
are
Yeah.
familiar with some of them so that you could
Yeah.
be helpful with that. I'm really glad you talked about the vitamin D. I live in Florida, and I'm very fortunate that I get to be out in the sunshine quite a bit, and my husband is my partner, and we spend most every waking hour together and sleeping hour. And so we are out in the sun about the same amount of time, and I was low and
Mm-hmm.
he was fine. So I think that, it may be not just, and here I am in Florida, right? So I'm
Mm-hmm.
getting sunshine year round. I think that there are just a lot of people that maybe genetically they don't absorb it, or maybe their skin coloring the
Mhm.
lightness or darkness. I think that I really feel, because of all the things that I'm reading and listening to, I think that everybody should have their vitamin D level checked, because, and you can talk about a little bit about that. It's not a vitamin, really, is it?
It's a hormone. Yeah, absolutely. So you have to understand your body makes it, so it's considered a hormone, right? But it's, a hormone that you can fairly easily supplement with. Most people are going to require around 2,000 international units daily. And I would say if you've got plant-based kids, you definitely want to make sure that their vitamin D level is adequate, because now we're talking about, I really want to just maybe hone in on the osteoporosis side, because this really is a pediatric disease. So we have to make sure that that bone bank account, is kind of like to talk about, is that we've built their bones to the max that we can before they hit an age where we start seeing a decline annually of bone mineral density. And so vitamin D is a big part of that, making sure they have, high calcium foods, that they're being, eating a wide variety of these foods. And kids, as we all know, can be a little bit tricky and finicky, and parents are busy and may not be thinking about these different things. But again, I think it's really warranted to make sure your kids are being supplemented B12, vitamin D, and the omegas as well, and the iodine.
Yeah, so there's really a lot, and we can look in the internet and read all kinds of books, but sometimes you just really need a medical doctor who's familiar with this lifestyle, who can guide you, and you can tell them, which multivitamins, if any, that you're taking, and they can order different tests, like we were discussing, just to tweak it and make sure that you're on the right track, because it's easy to maybe have things that we're not getting enough, or getting too much iodine, and that could really change things for your health status. So it's nice to get a little checkup and make sure that you're on track.
Yeah, and even still, even if you find necessarily a plant-based doctor, you also want a plant-based doctor with some type of experience doing this. And because, there's a lot to it, and sometimes some doctors who are maybe just starting out may not have the education or know what to do. So that's the beauty of having like the plant-based telehealth. We have doctors with one, again, like I said, there's a network that we connect, but you also have doctors who with experience either teaching this or doing this regularly with patients. It's pretty amazing.
Okay, let's see our next question. Oh, there it is. Cheryl. Hi, Cheryl. What does a doctor recommend for osteoporosis? Are calcium supplements helpful or not?
So that really depends. So we're actually building an osteoporosis program, protocol for our patients that deals with, lifestyle measures. We talk about certain nutrients that are really important to make sure are in your diet, your vitamin D status, making sure your calcium is actually sufficient. So this is not something, oh, I'm just going to take a calcium supplement and walk away, because calcium supplements can be a disadvantage for your heart health, right? So they certainly can see calcium supplements actually increase calcifications of the arteries. So we don't want that to happen. So instead, what I'd like to do is tell people to use some type of app, either the MyFitnessPal or a Chronometer, or one of those reliable apps that allow you to actually weigh your food, measure it out for about a week, and check your calcium status. And if you're getting at least 900 milligrams, preferably 1,200 milligrams as a menopausal, or as a female, let's just say a female, an adult female, and a male would be 1,000. We would want you to be getting that in your food. So if you're seeing, wow, I'm consistently at 700, what can I do to increase, that calcium? Maybe I add in some soy products. So soy products, not, I'm talking specifically about soy milk, tofu, and edamame. There's less evidence on the tempeh and miso, so I would stick to the non-fermented forms of of soy products. What we find here is those have some really amazing benefits, because they promote bone mineral density, they decrease your risk for breast cancer and other things like uterine cancer. So again, those are very helpful to add, and they're usually high in calcium. So I would consider, adding some of those to get your calcium up with food. And so you would also want to take your vitamin D with your food. It's a fat-soluble vitamin hormone that you better take in with food. It's better absorption. And there again, there's many things that we want to talk about. Exercise is really crucial. And we're talking about resistance or weight-bearing exercise, not just walking, but maybe walking with a very light weighted vest, doing some type of resistance training 2 or 3 times a week. lifting weights, kettlebells, bands, it doesn't matter. I love to jump rope. I do kettlebells. I run regularly. So all of those things, whatever you can do to promote your health, especially the younger you are and consistently do that, the better. And once you have osteoporosis, especially if it's severe osteoporosis or you've had what we call fragility fracture, it becomes a much more difficult conversation and a little bit more tricky as far as what you should be doing, because we obviously don't want a hip broken or back broken, because then it can be a downhill slide from there. And certainly I've seen many elderly who have a fall and a fracture and never recover, and it's a devastating thing to happen. So if you can do anything we can do to prevent it now, so if you're earlier you are, the better. Get busy, and again, we'd be happy to talk you through that as an individual, because you also want to make sure that if you're on thyroid medication, that's not too high. It's some people are there's these anti-aging physicians who place people who have normal thyroid function on thyroid medication, then they become hyperthyroid, which actually increases the rate of osteoporosis occurring. So again, many things that we need to take in. Remember, the body wants to be in balance. We don't want to do mega doses of anything to cause an imbalance of things. So just really important to think about that. There's so many factors involved with your bone health.
Right. And we had a few of the doctors that are with plant-based telehealth on the Be Green with Amy Live, and I'll give you links to that later, so that if you wanted to watch and learn more about osteoporosis and bone health. And also he did another show about thyroid, and this was all with the doctors from plant-based telehealth, and they're so knowledgeable and helpful, so you might want to review that. So let's see our next question. Anne, hi Anne. What do you recommend for IBS-D? I love beans, but they make me really sick.
So first of all, I would make sure that's actually what you have. Again, each person's history is really important. So you'd want to take that individual and see what their testing they've had, what past medical history, make sure there's not inflammatory bowel disease or something else that's occurring. So let's say that she is having irritable bowel syndrome with diarrhea. Beans can be really difficult. And so this is where we would be very gentle and enter you into kind of it's not, I would say, an exclusionary diet, but we start you on really well-cooked foods, first of all, and stay away from the raw for a second or two, and just slowly build into those more fibrous foods. So you want to start with, starchy veggies. And if you do eat your greens, you want to make sure they're well-cooked. If you're doing fruit, make sure it's blended like a smoothie or something. And then you just slowly, gently start adding in those foods. And over time, what you'll see is that typically will improve. But again, you also want to make sure that other more serious concerns have been excluded that are causing that type of diarrhea. So I would start with lentils once you start introducing beans into the diet. And it may just be amount. It may be a very small amount. It might be a matter of a tablespoon of lentils a day. And as you find that that's tolerable, then you start adding maybe 2 tablespoons. And then again, you just start adding, maybe you go into chickpeas and a hummus, or then, saving those kidney beans and black beans for last. But just, gently moving into the bean categories, the nuts, I would say, for very last. Your grains, you'd want them well cooked as well. Instead of brown rice, maybe use white rice in the beginning. Again, those are not the foods that we'd always want you to be consuming, but that you have to build into it with some patients, and their bowel situation can be a really big deal.
And that's just something that even a typical gastroenterologist, if you talk to them about beans, they may not be familiar with how the degree of beans. I mean, there should just be this little chart about start with these beans, don't start with those, because you'll have and it's just things that people aren't really familiar with, and you are. And it's and I've also heard we had somebody else on the show who was a plant-based gastroenterologist. I'll put a link to that, and she was talking about how sometimes just the broth, you can have a couple of spoonfuls of the broth that something was cooking in order to start off. And we talked about the microbiome, obviously, and you're very familiar with that. And sometimes that kind of plants the tiny seeds in the microbiome to make that population grow so it can be more accepting. So some people are some doctors are on board here and are learning, and we want to get more. And of course, you're always looking to add doctors on to plant-based telehealth, and so it will be very interesting to see. Although you have a lot of doctors now and they all have different specialties, but it'll be very interesting to see the other rock stars that you attract. And speaking of rock stars, Dr. Clapper is one of the doctors on plant-based
Mhm.
telehealth. So if
Yeah.
you ever had a wish that you could have them for your doc, well, you could. And you
If
could.
they're in the state at the time of the license, so remember, Dr. Clapper is licensed in California, Hawaii, New York, and Florida. So
Okay.
as long as at the appointment time that you're physically in that state, you don't have to live in that state, but let's say you live in Georgia, but close to the Florida line, and you wanted to drive over so you can make an appointment with Dr. Clapper, that's absolutely okay legally. We just have to be very easy, because very smart about this, because if you have a physician who doesn't have a license in a particular state and they see you and they're doing medicine, which is what we're doing, they could actually get in trouble and lose their license in all states. So you're practicing medicine without a license, and it doesn't matter if you're a physician in good standing in another state or not. So just keep that in mind.
Right. So you just have to plan a vacation to Hawaii and then you could call him and it would be just fun.
That would work. That would work. Absolutely.
Okay, let's see our next question. Cindy, for thyroid armor, okay, you're going to have to pronounce that medication. I
Levothyroxine.
have been on armor for decades, but maybe the other is better or not necessary to change.
It really depends. So, I prefer to use the synthetic form of thyroid medications. It's just much more easily adjustable. When you look at Armour Thyroid, plus it's not vegan. Armour Thyroid is not, it's made from animals. And not the thing about Armour Thyroid, it contains two different types of thyroid hormones, the T4 and T3. The problem with it, they're not physiologically ratioed. And on a rare occasion, I do have a patient that does require, a levothyroxine, which is a T4, and maybe something called cytomel or liothyronine, which is a T3. I've been on levothyroxine for 25 years. And so it really would depend on your test. What's your desires? We could definitely try going to levothyroxine. Most people do just fine. Like I said, there is a rare exception that we would do combinations, but we'd also put you on a physiologic amount. And again, that's just where some blood tests would be important.
Wow, that's fantastic that you can just help people tweak. And that's again, your lifestyle doctors, lifestyle medicine. You don't just try to do some kind of holistic healing and say, okay, just eat this diet and everything will be fine. But
Right.
you're not also just pushing only medications and procedures. You're getting that balance, and your goal is to heal instead
Right.
of maintain.
Yeah, and I really want to caution people that anyone who says that the diet will heal all things and that's all you need to do is, I don't feel, practicing safe medicine, because there will still be places that you do need medication. And that includes a host of different types of variety of patients, hypertensive, diabetics, hypothyroid, all of those things. And so it's just really important that you look at you as an individual. Yes, this diet is across the board for humanity the most healthy diet and one that we should all be on. But then we have to start looking at other things that are occurring, absorption, inflammation. Again, we don't come into this diet from day one of our lives. We come into it at a different point in our lives. And there maybe have some things occurred that we have to actually think about and really be very careful that we're not causing more harm by removing certain medications. So again, we have to look at you as an individual. We can't just say across the board, it's not a panacea. It's a fabulous tool. It's a very powerful tool, and probably the most powerful tool I've ever used to get patients well, but it is not a panacea. In those who say that it is, I would caution in taking on whatever they're saying. Just be
Right.
careful. Yeah,
And for most of us, we haven't been on this lifestyle for our entire lives.
right.
So even though in a short period of time you can come off or titrate down a lot of medications, you can feel like you're getting better sleep and you have more energy and a lot of things, and the weight is coming off and all these
Mhm.
wonderful things are happening. And your body is a self-healing machine, but that doesn't mean that there aren't some things going on that maybe need some more attention. So it's nice to know that you have all of those things in your wheelhouse to help us.
Yeah, absolutely. And, just think, it's a very good example would be a diabetic. So by the time you're diagnosed with diabetes, on average, they think you've lost about 50% of your beta cells, which are the cells that actually make insulin. So if you think about that, some individuals may not be able to get off completely all medications. And so there's just some things to think about when that, again, where we look at you an individual, we look at the data doesn't lie. And the data will, along with your desires. And of course, the final decision is always up to a patient. But we just really want to feel like we want to guide you, but we want to give you all the information we can, so you can make a proper decision, an educated decision with us as guiding you along the way. And many times I'll get patients ask, well, what would you do? And I will be happy to tell them what I would do. And you may not agree with it, but then again, that's okay too. This is the beauty of being an individual, but at least you have all the information and you've been provided an opportunity to make that decision yourself.
Right. And you look at the whole body, and you ask all the questions about all the different systems in the body, because they do sometimes affect each other, and sometimes something could present itself and it may not even be what a general physician without knowledge about this lifestyle would even understand, because they weren't trained in nutrition in medical school.
Right.
And now you talk about diabetes, and I wanted to I love making announcements on this broadcast, so I do a little drum roll. So you are involved in a really exciting project that
Mhm.
our viewers may be interested to know about, and to help people with diabetes. Can you talk about that?
Sure. So I've been friends with Nelson Campbell, Kim and Nelson Campbell from Plant Pure for many years. And they've invited me to be part of a special 10-day immersion where they'll be actually filming for a new documentary. And that'll occur at the end of October, October 22nd. So if you're interested, if you're a type 2 diabetic, diagnosed probably in the last 10 years, and you happen to be on insulin, we have to set certain criteria. We're only going to be accepting 5 individuals and their spouses if they also have some illness, to come to North Carolina and spend 10 days with us. And they get all the food. They do have to, fly themselves there, but they have all the accommodations and the food. I think there's maybe a small amount of food charge. I don't know all the specifics on that cost, but it's not going to be much. But basically, they would spend the 10 days with us and then they fly home. But I'm there to make sure that they're doing okay and monitoring their health, because I am licensed in all 50 states. I can do that in North Carolina. And the fun part is, you get to hang out with all of us and we get to eat some really yummy food and get better. So if you are interested, you could email immersion at plantpurecommunities.org and send the information, your age, your diagnosis, if you're on insulin. If you're not a diabetic on insulin, this is not going to be the opportunity for you, but maybe in the future. But we're looking for specifically type 2 diabetics who require insulin and diagnosed in the last 10 years or so. That way we can hopefully have some good beta cell function, and that we'll see some really good, nice, quick responses. And that typically is what we see.
Well, that's really exciting. And so anybody that has wanted to adopt this lifestyle and maybe was a little hesitant, or you're doing it but you're not in 100% and you really could tweak it, this is a really great opportunity. And all of us in the plant-based community are always looking forward to studies that prove that this
Right.
lifestyle can be helpful. And so it's so exciting for me, and I'm sure lots of people, that you're doing this, because the data is going to be just fabulous, so
Yeah,
that we
no, it'll
can.
be fun. It'll be actually recorded, which will be great. So we're super excited. Hopefully that documentary will be available early next year.
Oh, that's wonderful, because we're always looking for another good documentary to watch that
It'll be
supports
my
the
first, so it
community.
should be a really interesting opportunity.
Yeah, excellent. Well, I just really wanted to thank you so much. I wanted to put up again the link for the plantbasedtelehealth.com. So if you wanted to get in touch with Dr. Marbas or any of the other doctors there and to have a consult, go to plantbasedtelehealth.com, and they have a lot of information there, and they make it really easy for you to sign up if that's something you're interested in. So do you want to talk and say something to our viewers and listeners about either about plant-based telehealth or about this lifestyle? What do you want to say for your last few words of our
Sure, thank
interview?
you. I would say, really consider checking us out, or maybe even referring us to someone maybe that is struggling with medications or something and trying to adopt the lifestyle. Check out plant-based telehealth. There's 9 doctors right now. We're working on getting our 10th, and we're super excited. We're growing by leaps and bounds. As you know, March will be our 2nd year, and it's been quite a journey, but I really feel like we could help those who've been on a plant-based diet, those transitioning to a plant-based diet, or maybe those who are just plant curious and where you're like, how could this help me? And we're always happy to answer questions. So please feel free to check us out at plantbasedhealth.com. We have some amazing physicians, and I'm honored to work with them daily. So I think we could definitely be of some benefit.
Wow. Well, thank you. I know that there are going to be people going to your website because there's a lot of information there and you're going to be helping so many people. I'm always excited for that. And I'm always excited to support anybody that wants to spread the word about this lifestyle and help others to manage it and adopt it or even flourish with it. So I did want to thank you again, Dr. Marbas, for coming on Be Green with Amy Live. I also wanted to thank someone who's been in the background, and that's our engineer, Rebecca, and she's from PKA Styles. Hi, Rebecca. Thanks so much. She's been doing all the wonderful cameras and comments, posting, and so forth. And I want to also thank Jess from Jess Task Voice. She did the promo and she did the countdown, and she's also going to be showing us who's coming up next. So let's see, Jess, who is coming up next?
Dr. Stuart McGill is an expert on back injury and pain mechanisms. Difficult back cases are regularly referred to him for consultation. Join us on Wednesday, September 29th, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
Well, most of all, I really want to thank all of you for watching and joining and listening, because without you, I wouldn't be here. You're my reason for being here, because I want you to help me spread the word about this lifestyle, how it's helping you, how it's helping your friends, family, and what you can do to help support the world in learning about this lifestyle. And also, what I'm going to be doing is I'm going to be signing off with Dr. Marbas with my tagline, be strong, be well, and be green. And if you guys can sign off with us, you can type it in the comments while we do it. So are you ready, Dr. Marbas?
Yes, thank you.
Okay, until we see you guys again, remember, be strong, be well, and be green. Bye-bye.